lovely people, how are you doing? I hope you're doing beautiful well wherever you are. Welcome back to my channel. If you're watching me for the very first time, my name is Chinaza, and on this channel I discuss all about wellness. I also talk about healthy lifestyle tips, and I discuss also on Germany residency information. But today we'll be looking at yeast infection, what causes yeast infection in females, what are the symptoms, and the treatment for this yeast infection. Before we go into this video, I want to say a very big thank you to all of you that have subscribed to my channel. Thank you so much, and God bless you. Thank you for making out time to watch all of my videos. The comments in the comment section, they are so encouraging. If you've not subscribed, please do well to subscribe by touching the red subscribe button down as you're watching the video, and touch the bell there and turn it on so you'll be also notified whenever I post a new video. Let's go on. Vaginal yeast infection can be tricky, and it can also be called candidiasis. This is a fungus that the immune system should keep under control. When we talk about this kind of disease, people begin to wonder if they are STDs or STI. Some people who are not yet sexually active can have vaginal yeast infection. This yeast infection can also occur in the mouth, which is called thrush. You have swollenness in the mouth, or you have white patches and sensitivity in the mouth. It can also occur in the oesophagus. It can also occur in the gut, in the intestine. So yeast infection is not only occurred in the vagina. There are a lot of places that it occurs in the intestine, the oesophagus, the gut, and also in the vagina. So now, what are the symptoms that females experience when they are having vaginal yeast infection? Okay, the first and general symptom that every female who is having vaginal yeast infection experiences is sensitivity, irritation around the vaginal opening. Okay, this person begins to have sensitivity or irritation. The person begins to scratch the vaginal opening, okay, not really inside but outside the layers. Sometimes you should pay close attention to yourself to know the real cause of this. Did you shave newly? Are you having skin reaction? Are you reaction to the cream that you're using or the soap you're using? What are the new things you've started using recently? Are you using feminine deodorant? Are you using a different pad from the one you're using formerly? Are you using a different tampon? Did you expose yourself to general toilet? All of these things can bring about reactions that will all also resemble yeast infection. But if you're having vaginal yeast infection for real, you'll be having sensitivity, you'll be having itching, and you'll be scratching. You can no longer put yourself under control. No matter where you are, you feel a scratching, and most rarely you're scratching, you're feeling that it's not painful, but at the end of it you would have given yourself some bruises, you begin to feel pain. Another common symptom is burning pain. Okay, burning pain if you want to urinate. Note that this burning pain can also be a symptom for other serious underlying infections, STDIs, STIs, sexually transmitted infections, and STDs. Okay, gonorrhea, all those kind of other serious infections. But if you're having yeast vaginal infection, you can also have this burning sensation where you're urinating, and you can also have painful intercourse. Okay, maybe you're dry and all. This is a different topic for another day. We're looking at the general causes or the symptoms that you see, and you can be able to check yourself to know if you're having vaginal yeast infection. You can also have abnormal vaginal discharge. It could come in cloudy or whitish patches. It can also be watery discharge. Sometimes it could be smelly, sometimes it could not be smelly. But if you are very close to paying attention to yourself, you know what is normal, and when it goes out from being normal, you should also be able to notice and go on to test yourself or visit a gynecologist to ensure that you find out what exactly the problem is and solve it earlier. Do remember that I said that this vaginal yeast infection can also resemble bacterial infection. It can also resemble STIs. It can also resemble STD. It can resemble ordinary shear rash from shaving. Okay, or you have hairs, you've not shaved. Maybe you're used to shaving, you've not shaved for some time. You could have irritation. Okay, you could also have this symptom. You can also have hormonal changes. Okay, if you're having hormonal or change in hormone level, maybe before your menstruation or after your menstruation, this could also put a resemblance. So you must find out what it is and solve it. Now let's look at the treatment. What are the treatments for vaginal yeast infection? The first treatment is that you should let it go on its own. If you have minor vaginal yeast infection, sometimes they tend to go away on their own once you stop what is posing the cause. Maybe you changed products that you're using, you changed your sanitary pad, you changed from pad to tampons, you're taking antibiotics that is not suitable for you, you discontinue from taking this, you're doing something new, okay? When you do discontinue from doing what you started doing that's causing this tends to go away on its own. The next thing to do is to visit a gynecologist if you're having severe and complicated symptoms that have to go on its own. Before you go into getting over-the-counter medications, ensure that you get instruction from the gynecologist who will be able to cancel out other posing or underlying causes and ensure that these medications you're about to get are safe for you as an individual. Now, what are the kind of medications that you may be asked or required to get? The first is cream. Another type is tablet that you insert. Another type is also tablet that you drink, that you take with water. If you're going to be using cream, we have the ones for internal and the ones for external, depending on what the gynecologist finds out that is causing this. If the issue is mainly on the outside, the wall of the vagina, you will be asked to apply this cream on the outside. If you have a major infection that needs to be treated from the inside, you will be asked to also apply this cream on the inside. This cream also comes with things that you will use to apply them inside, okay? If you're going to be taking treatment, whether you're inserting tablets, whether you're drinking them, or you're using cream for internal or outside, okay, purposes, the best time to apply this is at night when you are at rest. So the movement, for example, you just started a tablet or a cream, so the movement does not distort the whole thing. And sometimes you have discharges that are okay, that are coming out, and that may be so messy. So it is best to apply all of this at night before you go to bed, so in the morning you can be able to take a shower, change, and be clean also. But if you cannot, if you must apply this in the daytime, I advise that you use a panty liner. This is to prevent mess on your panty and on your dress, embarrassment and all that, to avoid you being soiled, because discharges will always come out to ensure that the process is progressing. So you should use panty liners if you're going to be treating this vaginal yeast infection with cream, external, internal, tablets, insert, and tablet taking. This is best applied during the night time, but if you cannot, if you must apply it in the daytime, try to use a panty liner to avoid being soiled. Now, in summary, you should see your doctor if these symptoms persist after 2 weeks. You've allowed it to go away on its own, you've changed what is causing it. Maybe you are having bacterial infection, you are taking antibiotics, you are taking contraceptives, you're taking hormonal medications, you treated STDIs or STDs, okay, you just had shear rash or you shaved and you're having these symptoms. You thought that after discontinuing some of these things you'll be fine, and you did not have the required result. Do not go ahead to get over-the-counter medications without seeing your gynecologist, who will rule out what the causes are and the best way to treat them. After 2 weeks, you should see your gynecologist, especially if you're pregnant. A pregnant woman is not allowed to take any medication without being given to her by the gynecologist to ensure that the baby and the mother are safe. Finally, if you're thinking that letting it go on its own is not the best option for you, maybe you have a spouse, you're married, ensure that you treat this and treat it very well to avoid spreading it to your spouse, who will in turn give it back to you. So that's all that we have. I hope you learned something from this video on how to treat vaginal yeast infection in female. If you're also a man, you can also help your wife to learn this video. Don't forget to share this video with your friends, family, your world. Share it out to everyone, to every lady there who will benefit from this, okay? And subscribe to my channel if you've not done so to support me. Give this video a thumbs up, okay? And ask me questions concerning things you don't understand in the comment section, and I will come back to reply all of these questions on my next video. I will see you then. Have a great time. Bye.